Hello and good morning. My name is João Vieira. I am a certified rehabilitation registered nurse and I am part of a team of three certified rehabilitation registered nurses consisting of Ricardo Susano, Maria José Bule and myself. And we wish to develop some videos in which we will present detailed breathing exercises that are aimed at people who want to improve their breathing, either sick or healthy. Please don't be surprised that sometimes I look away. In order to follow what we have prepared to you, sometimes I will appeal to a text, as we are developing these videos in several languages and we want them to be all similar. Due to the current COVID-19 pandemic, which will directly or indirectly affect most of the people in the world, we decided to produce some videos that we believe can help some people infected with the COVID-19 and who may develop some respiratory symptoms, more characteristics of the disease. As everyone knows, one of the most important contingency measures that is taking place all over the world is staying at home. In addition, the statistical information we have now suggests that the majority of those affected by the COVID-19 will develop mild or moderate forms of the disease. It is for these people who will remain at home that we direct these videos. Our commitment is to produce some short videos in which we will present to you some exercises to improve your breathing functionality, which can be performed without the use of any special equipment and at home at any time. It should be noted that all the exercises that we will present to you are supported by scientific evidence and do not have any major complications or contraindications identified in the current literature, which lead us to say that they are efficient, feasible, and safe. In this first video, we talk about breathing control exercises, for which we will associate two exercises simultaneously, whose objective is to reduce psychic and muscle tension and decrease muscle overload. As you will be able to see, these are extremely easy exercises to perform. Dissociation of respiratory times, which consist in inhalation through the nose and exhalation through the mouth with the lips half closed, and diaphragmatic breathing or belly breathing. These exercises should be performed preferably in a lying position, and that will be our second video, in the supine position. However, when the person feels familiar with this execution, they can perform them in a sitting position, as I am right now. This first exercise, the dissociation of respiratory times, takes place inhaling through the nose and exhaling through the mouth with with semi-closed lips. The inhalation through the nose contributes to the heating, filtration, and humidification of the inspired air. The exhalation through the mouth with the semi-closed lips makes it possible to generate a small positive pressure that can contribute to the reduction of the collapse of the airways. Some authors report that these exercises contribute to the increase in the air volume in the lungs and alveoli, and thereby improves gas exchanges, contributes to the decrease in respiratory rate, improves exercise and activity tolerance, and in some studies there are significant improvement in blood oxygen saturation. Many nurses have the habit of introducing this technique to the patients by saying the expression smell a flower for 3 seconds and blow out a candle for 3 seconds without extinguishing it. We present an alternative to this expression and suggest to smell a very good birthday cake for 3 seconds. The cake is very fragrant, and blow out the birthday candle for 3 seconds without extinguishing it, always with your lips semi-closed. Let's go for the demonstration. The second exercise, the diaphragmatic breathing or belly breathing, consists of performing breathing with a greater incursion in the diaphragm, which deep and slow inhalation and slow exhalation. When deep and slow inhalation and slow exhalation are performed, with the aim of improving ventilatory efficiency, with improved gas exchange. The person must place one hand in the apical region and the other in the epigastric region and direct all the inspired air towards the abdomen. The stimulation of the end allows the person to become aware of the exercise and better understand the objective. That is, with the ends positioned in the apical region and the abdominal region, you should inhale deeply and slowly through the nose, directing the air to the abdomen, checking the elevation of your end position in the abdomen, and then exhale slowly through the mouth with the lips semi-closed. And then the end position in the abdomen must accompany the movement and can apply light pressure to help expel all the inspired air. Let's go for the demonstration associating the two exercises. Breathing control exercises, which consist of performing the exercises described above for dissociation of respiratory times and diaphragmatic breathing, should be always the first step of any respiratory rehabilitation exercises, as it allows improved coordination and efficiency of respiratory muscles, improvement in the ability to control breathing, relaxation of the back of the chest and scapulohumeral region, physical and psychological relaxation. Please perform these exercises whenever necessary, especially when you feel tired and have difficult breathing. You can do these exercises for a few minutes until you feel the relief of the symptoms, or periodically to improve your breathing functionality. As you can see, these are exercises that can be performed at home without the need of any equipment, and we believe that many of you will benefit from performing these exercises. They are very simple, they are safe, they are feasible, so let's do it. Please share our videos because we want them to circulate all over around the world. If we help one people, we will be very satisfied. And to improve the circulation, please like the video. That's all, folks. Wait for our next video.